Hello friends, I am Chris Kuriakos.
First of all, thanks for all your support. This is the 8th video of the OET series classes. Best of lucks. Hi all, let's discuss on the 4th subtest of OET exam. That is the speaking test. When you are doing the OET speaking subtest, you should use positive language and avoid negative language. This is because your job as a healthcare professional, who make the patient feel comfortable and relaxed. When you are talking with the interlocutor, who is acting as patient or relative, you should be careful in your choice of words. Also, it is important to convey the correct information. Let's have a look on it detail. The entire subtest will take about 15 minutes. The speaking subtest of the OET is one task that is divided into 2 separate role plays. The role plays will be between you, playing a health professional, and an interlocutor, playing a patient or patient carer. These role plays will relate to real-life interactions you may have in your specific healthcare field. You will also have a warm-up conversation with the interlocutor before you begin the role plays. However, this conversation will not be assessed.
How does the OET speaking subtest work? The speaking subtest consists of 3 parts and will take a total of 20 minutes. First, you will have a warm-up conversation with the interlocutor, who is your partner for this section of the test, but they are not assessing your performance. The warm-up conversation will not be assessed, and is meant to relax you and get you comfortable with your conversation partner. They will most likely explain to you how the speaking section works and then ask you about your previous work, future plans and interests. After you have warmed up, you will be given a role play card with a scenario on it. You need to perform 2 role plays. The scenario will be similar to a real-life situation you might encounter in your particular profession. For example, if you are a doctor, the scenario will most involve a patient or patient's carer asking for information, advice and reassurance.
Once you have been given the role-play card, you will have 2 to 3 minutes to read it and prepare yourself to begin. This is the time in which you are allowed to ask your conversation partner to clarify anything you do not understand. You are allowed to ask questions about how the role-play will work and about any of the content you see on the role-play card. You may also write anything you want on the card before you begin. Finally, you will participate in the role-play for about 5 minutes. After you have completed this, you will be given another role-play card and you will repeat the process of reading it, asking any questions you have, and playing it out with your conversation partner. It's important to note that you will not be assessed during the live conversation you have with your conversation partner. Instead, your 2 scenarios will be recorded and assessed at a later. An example of role-play card is given below.
Tips to practice. To speak well during your OET speaking test can be a little daunting. Even those who are good at speaking falter or hesitate when it comes to taking this OET speaking test. But, you can easily get A or B provided you focus on basic things and follow our tried and tested OET tips. 1. Role play, playing your part. It is going to be a role play. The interlocutor might act as a patient or a client of yours. You will have to play your role. That is, you are a doctor, nurse, physiotherapist, dentist, etc. Remember, you will have to speak like professional and take the interviewer as just one of your patients or clients. 2. Beginning the conversation. A lot of candidates make the mistake of thinking that the OET speaking subtest is an examination and not a medical situation. As such, they wait for the OET person, the patient, to do the talking. Imagine that you are in a professional setting and you're the nurse, doctor or dentist. You are in control. The OET person is the patient, not the OET person. As such, it's up to you to start the conversation. For example, hello, my name is Jane and I'm the community nurse. Can I start with your name?
3. Continuing conversation. You will have to keep the conversation moving. Yes, you should not stop. If at any point of time, the conversation stops and silence pervaded, it will be your responsibility to make it go on again. For instance, you can keep ready some joiners or silence breakers to use as the situation demands. Example. Can you give me more information about it? Can you tell me more about it? Is there anything else which is bothering you, keeping you distracted, which you would like to add? 4. Do not hesitate to ask questions. The more the number of questions you ask the patient or the client, the interviewer, OET person, the better it is to attain higher grade. Even if your patient is reluctant to speak, he or she will have to answer the question. Your primary purpose here would be to keep the patient talking. You can ask some common questions depending upon the topic or medical situation given. For instance, do you still feel pain? How do you rate your pain on a scale of 1 to 10? How long have you been suffering from this? What are your current medications?
5. Listen to the patient. Although the OET speaking subtest is a test of your speaking ability, it is as much a test of your listening ability. In order to reply, you need to understand what the patient says. More importantly, you need to listen in terms of hearing what the person has to say. Don't just concentrate on your performance, concentrate on communication. You need to respond appropriately to what the patient says, even if you are nervous. When you listen to the patient well, you will be in a position to offer the best advice, suggestions or recommendations. 6. Refining your language. Be humble, be respectful and be distinctively understandable. You certainly do not have to speak fast. Speaking fast is not at all fluency. Your interviewer might not be able to understand you well if you speak fast. So, lower down your speed and try to speak more calmly but more intelligently and precisely. Focus on what you are saying and how you are saying. Depending on who you are speaking to, you need to adjust your language to suit the scenario. Think about this. You are talking to a depressed 87-year-old man. You are talking to an aggressive 18-year-old man. In these cases, the language, mood and expressions are totally different. 7. Be ready for all odds. Your interview person might ask you some odd questions which may contradict to standard medical knowledge. So, at such times, it is always wise to answer more politely. Do not assume that your interviewer is not aware of what is happening in the modern world. He or she asked you only to understand how better you would respond to adverse situations.
Hope you understand the details enlisted in the video. Our doors are open for your dreams. Thank you.